Hello everyone, this is Dr. Anil Kumar, a practicing anesthesiologist from Kakinada. We will now discuss about BCLS, Basic Cardiopulmonary Life Support Guidelines and Algorithm, which are developed by IRCF, Indian Resuscitative Council Federation. These guidelines are developed considering the need for universally accepted practice guidelines in India, bearing in mind the limitations of resources throughout the country. Optimal outcome of cardiopulmonary arrest outside the hospital depends upon certain links that need to be followed. The four essential core links in BCLS are early recognition and activation, early high quality CPR, early defibrillation, and early transfer. We will discuss about all these core links in detail later. What should you do when you face a situation like an accident in the middle of the road, or a person caught in a burning house or a car, or a person lying down beside a live electric wire, or a person is collapsing in front of you, or a person already collapsed when you reach there, or a lay person is doing CPR, which means calls. So you are an expert BCLS person, so you went there to a person who is doing calls. In case you observe the victim, as I said earlier, you should start immediately CPR. But before starting the CPR, as mentioned in the algorithm, certain sequential steps should be followed. The initial step is ensuring the scene is safe. You should do CPR in the safest place. The first step in managing the cardiac arrest victim is to ensure the safety of the victim as well as the rescuer. The victim may be in the various scenarios as I said earlier, but you should be more vigilant and observe whether the place is safe to resuscitate the victim or not. If the place is not safe, you may get injured. If the arrest happened inside the mall or gym or any restaurant, the places are safe, you can start the CPR immediately. But in some scenarios where you might get injured, shift the victim with the help of local police or local people or lifeguards to the safe place and start the CPR. Once the victim is in the safe place, immediately check the responsiveness of the victim. How you check the responsiveness of the victim? By tapping the shoulders of the victim from the front and asking loudly, "Hello, how are you?" in the language where the victim can understand. Do not tap on his face or shake on the victim, because it may cause movement in the neck level, so it may injure if he or she has a cervical spine injury. In the case if the victim is responsive, that is the victim is showing some verbal response or some purposeful movements, then cardiopulmonary arrest is unlikely. So make the victim in recovery position and constantly observe him until he or she is shifted to nearby medical facility for further evaluation and management. If the victim does not respond, he might be in cardiac arrest. What should you do? What should you do then? You should shout for help. You should call 108 or any local emergency number and inform the emergency medical team about the victim and ask them to bring AED with them. You call the emergency medical team over the phone. What should you inform the emergency medical team? First of all, you should identify yourself. Who are you? From where you are calling, the exact location precisely, so that the emergency medical team will come immediately. You should tell about the victim, what is the age, what is the sex and general condition of the victim, number of victims present there, a number of rescuers are present there. After shouting for help and activating the emergency medical services, what should you do? You should immediately check for carotid pulse and you should scan the chest and abdomen for the signs of breathing. For checking the pulse, You should first identify the thyroid cartilage or Adam's apple in the middle of the neck. And then you should slide your fingers laterally into the groove between the trachea and the neck muscles, and there you can find the carotid pulse. Assess carotid pulse and breathing within 5 to 10 seconds. Don't do more than 10 seconds. And chant 1001, 1002 up to 1010 for the assessment of time of 10 seconds. Avoid delay in initiating high quality CPR. You can check the pulse in both sides of the neck. And if you find a person who is having agonal gasps or gasping breaths, but there is no pulse, there is no definite pulse, assume that person is in the cardiopulmonary arrest and immediately start the CPR. Sometimes if you don't find the breath and as well as pulse, then also you should assume that the patient is in the cardiac arrest and immediately start the cardiopulmonary resuscitation. Don't take more than 10 seconds in checking the carotid pulse. Don't check the carotid pulse on both sides of the neck simultaneously. Don't change your position for checking the carotid pulse. Don't forget to scan the breathing while you check the pulse, and don't delay the high quality CPR. While checking for pulse and breathing, you may encounter the scenarios like the person or victim is having both definite pulse and breathing. So in this scenario, you should monitor the patient every 2 minutes. You should see whether any changes or any dangerous signs are happening in those victims. You should closely monitor the victim every 2 minutes until the emergency medical team or ambulance reach your place and shift the patient or victim to the nearby hospital for further management and evaluation. In the second scenario, like the patient is having a definite pulse but there is no breathing, it is a respiratory arrest. So you should give breaths to that patient. How you give the breaths? You should give breaths every 5 seconds. That means you should give around 12 breaths per minute. You can give a breath through mouth to mouth or mouth to mask or bag mask ventilation, and the breath should be given over 1 second. You can count or you can chant 1001, 1002, 1003, 1004, 1005 and then give a breath over 1 second. So you can give over 12 breaths per minute. What is the N thing for the bag mask ventilation is visible chest rise. You should see the chest is rising appropriately so that your breath is going good. You're doing very good breaths then. And you should observe the patient. You should observe the pulse, whether the patient is going for a total cardiac arrest or not. And wait for the emergency medical team to arrive and then shift the patient to the nearby hospital for further management and evaluation. And the third scenario, like you observe the patient where there is no definite pulse, no breathing, or there is no pulse and breathing is agonal breath or gasping breathing. You should consider that patient as a cardiopulmonary arrest and you should immediately start high quality CPR. What do you mean by high quality CPR? High quality CPR means if you find a victim of cardiac arrest, you should immediately start the chest compressions. And you should initiate the cycles of CPR. Each cycle comprises of 30 chest compressions and 2 rescue breaths. For effective chest compressions, shift the victim to the hard surface, if not so, and identify the first of all, you should kneel beside the victim and you should identify the site for the compressions, which is the lower part of the sternum. You should identify the lower border of the rib and trace it to the middle of the rib cage, that is xiphisternum. Place the 2 fingers of one hand over it and the heel of another hand besides these 2 fingers, and place the heel of another hand over the first hand and interlock the fingers. and your elbows and wrists should be aligned in the same straight line, and your shoulders should be put aligned such like that they should be on the top of the chest vertically. The movement should occur at the waist level. The chest compression should be administered at a rate of 120 per minute to a depth of 5 to 6 centimeters, and you should allow the recoil after each compression so that the heart will get refilled with the blood. So that should be subsequently forwarded in the next compression. Do not have interruptions in these compressions, chest compressions, and chant loudly while doing the chest compressions, such as loudly 1, 2, 3 up to 30, so that you can do properly. What should you do after giving the chest compressions? You should maintain the airway and give 2 rescue breaths after chest compressions. How you maintain the airway? The airway is maintained by doing some simple maneuvers such as head tilt and chin lift, which gives you the sniffing position. In case the victim had an injury over the neck, such as cervical spine injury or some other injuries are there, then give the patient the jaw thrust in manual inline stabilization. And by these maneuvers such as head tilt and chin lift, mostly it will remove the upper airway obstruction. This upper airway obstruction is mostly due to the tongue, which has a tendency to fall backwards and obstruct the airway. And see the airway for any foreign body, which is if the foreign body is visible, sweep the foreign body with using your 2 fingers, and if necessary use oral pharyngeal airway or nasopharyngeal airway to maintain the airways. How do you insert the oral or nasal airways? Mostly for inserting the oral airway, you should stand towards the head end of the patient or victim, and you should select the correct sized airway for the victim. How you select means you should measure from the corner of the mouth to the angle of the jaw, and with your non-dominant hand make the head tilt and open the jaw and see whether there is any foreign body and remove that foreign body obstructions or anything. And with your dominant hand insert the device with the distal tip towards the palate and insert it slowly towards the palate until you feel resistance up to hypopharynx. The device should be inserted up to hypopharynx until you feel resistance, and then slightly rotate the device to 180 degrees and slightly push the device until its flanges rest on the incisors of the victim. How will you insert the nasal airway? It is also same like an oral airway. You should select the correct size nasal airway. How will you select means you should take the nasal airway and keep one end of the device at the tip of the nose and another end should be at the earlobe. That will be the correct sized airway. So by using the water soluble lubricant and apply the lubricant to the nasal airway, and by keeping the bevel towards the nasal septum and insert the device gently until the flanges rest on the tip of the nostril. How will you give the mouth to mouth breathing? The mouth to mouth breathing can be given in the following by doing the following steps. Pinch the nose of the victim, open the mouth of the victim, take a deep breath and keep your mouth over the mouth of the victim, have a tight seal and give a rescue breath over the 1 second. Give 2 rescue breaths over 2 seconds after 30 chest compressions. And the end point of effective breath is visible chest rise or adequate chest rise. How do you deliver breath through mouth and mask technique? By mouth and mask technique, you should maintain the airway first, and you should keep the mask over the mouth of the victim using the C and E technique. What is C and E technique? You should hold the mask tightly over the victim's mouth with your thumb and index finger forming the letter C, and with your third and fourth and fifth fingers push the jaw upwards forming the letter E. So you can provide the tight seal over the patient's face and you can give the rescue breath. If the airway cannot be maintained with a single hand, use two hands and provide a tight seal over the victim's face and give the rescue breath. The effective breath, the end point for the effective breath is the visible chest rise or adequate chest rise. How will you insert the laryngeal mask airway? The laryngeal mask airway can be inserted by following steps. You should lubricate the posterior aspect of the laryngeal mask airway with a water-based jelly, and you should standardly hold the laryngeal mask with like a pen with your index finger at the junction between the tube and the cuff, and make sure that the black line on the tube will be facing towards the upper lip, and the mask aperture must be faced towards anteriorly. The laryngeal mask airway, to insert the laryngeal mask airway, use your non-dominant hand to make airway patent by tilting the head and keeping your non-dominant hand under the occiput of the victim's head, and with your dominant hand insert the LMA by putting your index finger on the tip of the LMA and pressing against the palate, and softly by one smooth movement insert the device. Don't force, and insert the device until the hypopharynx, until you feel some resistance to it, and then you should in these steps in these procedures, during this procedure, make sure that the jaw is not open, because what will happen if the jaw is open means the tongue and the epiglottis may fall backwards, which may give resistance to the mask to enter. So we should make sure that the jaw is closed when you are inserting the laryngeal mask airway. And after you insert the laryngeal mask airway up to the hypopharynx, and if you are until up to the you feel the resistance, gently remove your index finger. While removing the index finger, your non-dominant hand should be removed from the occiput, and just push the laryngeal mask airway with the non-dominant hand, such that it will not be pulled out when you are removing your index finger. And by placing the laryngeal mask airway, the correct position will be, the tip will be at the esophageal sphincter, so that then you can inflate the cuff and you can give the rescue breaths. How you perform chest compressions if two rescuers are present? If two rescuers are present, the work will be a little bit easy. So if two rescuers are present, start chest compressions and rescue breaths at the ratio of 30:2, like one rescuer, one person will doing chest compressions, another person will be at the head end giving the two rescue breaths. After 30 compressions, give two rescue breaths, each rescue breath for 1 second. So do CPR for 5 cycles. Each cycle consists of 30 compressions and 2 breaths. That 5 cycles means it will be completed over 2 minutes. So remember that there should not be any interruptions during chest compressions. And after 5 minutes of CPR, after 5 cycles of CPR, you should change the positions. And after 5 cycles, that means after 2 minutes, you should assess the patient. You should assess the patient's pulse and breathing. It's just within the 5 to 10 seconds, not more than 10 seconds. And if the patient has pulse, definite pulse, give one rescue breath every 5 seconds, and after 2 minutes reassess the patient. If the patient doesn't have any pulse, or if the patient doesn't have any definite pulse, continue the high quality CPR until the emergency medical service and AED is available. You are continuing doing CPR and AED or automated external defibrillator arrives. So what you will do? You should continue the chest compressions, and second rescuer will follow the protocols of the AED. The protocols of AED consists of few steps. In the first step, what you will do is turning on the AED. When you turned on, you will see some visual and voice prompts. Every AED will follow the regular resuscitation algorithms. Very few exceptions depending upon the manufacturer variations. The AED voice prompts mainly consists of to check responsiveness, to call for help, and then followed by CAB algorithm. And in the second step, you should expose the patient's or victim's chest, place the AED leads, one on the right below the right collarbone and the second one in the left axilla. There will be pictorial representations on the pads accordingly. And the third step, the AED will push the analyze button on the AED, and the AED will analyze the rhythm. While analyzing the rhythm, you should stay away from the victim. Once the AED analyzes the rhythm, it will prompt voice. It will be voice prompt from the AED whether the rhythm is shockable or not shockable. If the rhythm is shockable, AED prompts that to give shock. And if the rhythm is non-shockable, AED, there is a voice prompt from the AED to continue CPR for another 5 cycles and then reassess the rhythm. And in step 4, if the rhythm is shockable, the AED will give you shock because the shock is preset. If you have a manual biphasic defibrillator, you can initially charge your defibrillator for around 200 joules. So when the AED is delivering the shock, make sure that no one is touching the patient. You should be more vigilant and observe, and shout loudly that I am clear, you clear, and everybody is clear. And after delivering the shock, don't delay, continue the CPR. If the rhythm is non-shockable, you should continue the CPR for another 5 cycles and then reassess the patient. So in the step and the next step, if the patient is responsive, that means he is giving some voice or doing some purposeful movements, then make him in the recovery position, shift him in the recovery position and observe. If the patient is unconscious and if he has definite pulse and breathing, then also keep the patient in the recovery position so that there will be clearance of the airway. There will be airway clearance is there in the recovery position. So keep the patient in recovery position and monitor him until the ambulance arrives here to you and shift the patient to the nearby hospital for further evaluation and management. Continue the cycles of CPR until the patient is responsive. Here, by following the steps of BCLS, not just following the steps of BCLS, but the step should be in a quality. It should be in high quality. You should keep emphasis on quality check. Then only the outcome will be good. So, following the 4 core essential links of the CPR and following the steps of BCLS and with high quality, then the outcome of the cardiac arrest victim outside the hospital will be good and will be optimum. Thank you for listening the BCLS class. Thank you for your patience and all. Hope you learn BCLS. I hope you understand the BCLS steps easily. Thank you.